So I think that we can really build on what we've learned. There's no doubt about that. It doesn't mean that the way we were doing it before the pandemic was wrong. It's simply that through the pandemic, we've learned lots of different ways of doing things. And some of those different ways are really good ways of doing things. So particularly in reaching out to, for myself, preceptorship, nurses, newly qualified nurses and nursing associates, I've been able to do group reflection practice with them using a video format. And so for 2021, I'm just really quite excited about building on that, developing that. It doesn't mean that we will never travel, but it simply means that we can reach more people more easily.
We can change and move at pace when we need to. So I think some of that stuff that holds us back or has held us back previously, like Caroline said, travel, distance, all of that, we've kind of really addressed that. And I think actually that's really exciting. I've got a role, as has Caroline, that covers the whole country, and it's quite a large country. And being able to interact in different ways and use technology differently and have this kind of two-way communication without necessarily being face-to-face, but still feeling like we're in touch is really exciting. And hopefully, touching wood, it can't be any worse than it has been. We've got the, injections coming out, vaccines, and I think probably it's just really focused people on what's important. So it's quite exciting 2021, I think.
I think one of the things that has been the real positive out of the global pandemic has been, as Julie and Caroline both discussed, is our ability to keep contact with teams. So one of the things that I've put in every week now is I have a quality conversation with ward managers every Thursday afternoon. So I rotate that around our sites, and it just gives myself as the Director of Nursing and the ward managers the opportunity to have a conversation, whereas actually if I'd needed to travel to sites previously, that probably wouldn't have happened. So I think it's thrown most healthcare organisations into the technological age. So I think it's enabled us to develop much more effective systems of communicating, which have been really, really positive for all of us.
Particularly the learning that we've demonstrated around infection prevention and control, and the enhanced use of PPE, hand washing, the increased knowledge in the workforce. Those are really important things because COVID-19 isn't actually going away. We will have a vaccination, and that is brilliant. The efficacy of the vaccination, the duration that it will last or provide immunity is unknown, really. And I think to maintain those really high standards of quality around infection prevention and control is going to be really, really important. And without that, we could easily fall back into a position where we're not managing outbreaks or our staff or our patients going unwell. So it's building on that learning, sustaining it and building on it. It needs to become everyday practice.
And I think also, Chris, just to add to that, I think probably the whole of the country has probably seen how important the nursing and social work roles are across the UK, really, not just in Cygnet, but outside of Cygnet and across all organisations, really, and that actually they're of paramount importance in fighting global pandemics, and infection control is their business. And I think it's just shown the huge skill set the nurses and social care workers have, I think.
I also think that it's really kind of showing people how important relationships are and how important talking with each other is and sharing stuff, So there was some amazing pieces of work happened around supporting each other whilst at work and understanding that the impact that it has on everybody kind of socially, emotionally, and in terms of mental health as well. So I think, as David and Caroline said, making sure we hold on to all that good stuff and taking that forward and kind of not taking it for granted is really important. So I think there's been, weirdly, some good stuff that's come out of COVID in that respect. And that's the bits we need to kind of continue forward with, I think.